Actually getting ready to do an upper and lower blepharoplasty. And this situation, you can see the heaviness in this upper eyelid. We want to get rid of that. We can also see the fat pads down here and in both sides. So up here, we actually going to do blepharoplasty, get rid of excess skin and muscle. I'm pressing on the side here. It's a little bit of nasal fat pad there, which we can get out. But in the lower eyelid, there are 3 fat pads we're aiming at the nasal, we're aiming at the central and lateral fat pad. And there's just open that up to me. And it's a little bit of skin laxity here, which we can get. So we're actually going to do a little pinch blepharoplasty there too. To make sure the skin is actually nice and tight after we remove the fat. But let me start my markings. And in a male, the crease of the male eyelid is usually slightly lower than a female. So I like to assume that's about 8 millimeters. And a female could be about 8, to 10 on average. And you can go to about 12 in some females. Okay. So we want to keep it right in its natural crease. And we just definitely want to, lessen the heaviness of his eyes. Can you look me, please? And we just want to get rid of all this excess here. Okay, and close your eyes. So when I mark that, see where that comes? Begin with this here. We'll say goodbye to that. And we just gotta make sure we keep enough skin so he had upper eye closure. Okay, if I pinch this, his eye still remains closed, so that's a nice proportion. Okay, have you open your eyes for me? Let's mark on our incision. So put the lower lid is going to be placed right about here to about here. Not too long of incision. So that's about, I'll say, that's about 2 centimeters there. And we'll pinch this, and we have the central fat pad 2, and we have the nasal fat pad 1, and we have the lateral fat pad 3. So these are the fat pads we're going after. 1, 2, 3. And that's it. I hope I can take you on for the cruise. Thanks, appreciate it.